Our next guest joins us from Carson City. Stephanie Woodard is a doctor of psychology and the senior advisor on behavioral health for Nevada's Department of Health and Human Services. In addition, Dr. Woodard is the state's top authority for mental health and substance abuse. Stephanie, thank you so much for joining us. I know during these times, a lot of people are having trouble sleeping, they're depressed, they're feeling anxious. Is this normal?
It's absolutely normal. We're facing unprecedented times. Pandemics are disasters just like hurricanes and tornadoes. But unlike hurricanes and tornadoes that have a beginning, a middle, and an end that are fairly predictable, pandemics don't. And so there's a lot of uncertainty and a lot of stress that's involved.
What can people do to help themselves and their friends and their loved ones during these times?
There are some sort of key tips that most people would find helpful. The first, I think, is recognizing what is and is not in our control. Oftentimes, it's that sense of loss of control that can contribute to us feeling pretty stressed out. So sometimes even sitting down and making a list of the things that we directly have some control over and those things that maybe we get anxious and worried about that we don't can help us differentiate between the two. Keeping a daily schedule, trying to get up and go to bed at the same time every day gives us a sense of stability and predictability. And especially in times of uncertainty, that can be very, very helpful. Reaching out and staying connected with others and really building on your social supports can reduce feelings of isolation, but also give you an opportunity to really talk with others, talk about the things that you're thinking and feeling. It helps us all sort of process what it is that we're going through. And then good self-care, whether that's praying or meditating, eating a healthy, balanced diet, getting physical exercise, and engaging in things that you enjoy doing can also help to give us a sense of, relative normalcy in our day-to-day lives.
We've heard so much about social distancing, but there's also physical distancing. What's the difference between those two?
So when we talk about social distancing, we really are talking about physical distancing. It really includes things like keeping 6 feet apart from others while you're out in the community, but certainly not necessarily with people in your own home. And so when we think about social distancing, I think people have misinterpreted that sometimes to think that we need to also stay socially distant from one another. And while we want to stay 6 feet apart from others, we certainly still need to all continue to be socially connected. So doing things very similar to like what we're doing right now, getting on Zoom, even picking up the phone and calling someone can be helpful. There are also Facebook groups that people join so that there is a sense of community. And certainly even trying to stay socially connected while you're out in the community, smiling and waving at someone at the grocery store, talking to your mailman, all of those things are still very much allowed.
How about addiction? Mental illness. Many people suffer from this during the best of times. How is this changing things during these pandemic times, Doctor?
So none of us are immune to feeling the stressors of dealing with the very significant changes that we've had day to day. And for other people who may have already been coping and managing or even struggling with mental health or substance abuse, these can be particularly difficult times. For individuals who have experience with depression, anxiety, feelings of loneliness, isolation, hopelessness, all of this can exacerbate that. It can make it feel worse. So really very important for people who had previously been engaged in treatment to continue to stick with that treatment, even if it's through telehealth. Very few providers are currently providing face-to-face services in person, but most providers have been able to move to video conferencing or even phone calls to help people who are in need of care stay connected to that care. If people hadn't previously been in care and they're finding that they really do need some additional support or assistance, we encourage everyone to call and reach out to Crisis Support Services of Nevada. They can help people navigate towards the care that they may need.
How about substance abuse? Is there an uptick in people with substance abuse during these times?
So what we know from historical events following 9/11 and Hurricane Katrina, there is an increase in substance use, mostly because people are using it as a way to cope and adapt with some of these feelings of discomfort or concern, really as a way to manage their stressors. So it's predictable that we will see an increase in individuals needing treatment for addiction. But currently, I think a lot, because we're in still stay-at-home measures, we haven't seen a huge uptick in individuals that are presenting for treatment. That being said, we do have certain warm lines. Those are lines for individuals who aren't necessarily in crisis, but are just reaching out for help and hope. And what we are seeing through those warm lines is an increase in people reaching out, which is actually a really good thing.
How does an individual know if they should reach out for help?
At this time, anyone and everyone who's feeling like they need to just reach out and get connected to someone should never hesitate to do so. Everyone is struggling to manage and sort of navigate these very uncertain times. And so if that means that you need to pick up a phone and call someone, whether that's someone that's already in your social support circle, we definitely encourage that. But sometimes it's helpful to talk to somebody that you don't know, to really just be able to talk about the things that you're thinking and feeling. And if that's the case, Crisis Support Services of Nevada is available 24 hours a day, 7 days a week. And they have caring and compassionate people on the other end of the call that are just ready to be there for you and to listen to what's going on.
And how do you try to convince someone, a loved one or a family member, to take those same steps, what you just mentioned?
I think being compassionate and recognizing that everyone is suffering and we all suffer in our own ways. Some days can be better than others. And certainly if people seem to be struggling day in and day out for, days and weeks at a time, that may be an indication that they need something more. So sitting down with them and having an open and honest discussion about what you're seeing and what your concerns are, but also offering to help, to sit with them perhaps when they're making that phone call, and to continuously be able to encourage but not force, recognizing that everyone comes to the determination or realization that they need help in their own time. So really kind of coming alongside and supporting rather than trying to force or make very strong recommendations that they do so.
Many people, whether they're first responders or other essential people, they're working. Often then they're going home to their families and situations like that. And maybe they're feeling depressed or they're feeling something that, gosh, maybe I'm lucky to be working, or other feelings of mental illness like that. Is that normal? What advice would you give to someone like that?
It's actually a sign of mental well-being when people are under extreme stressors and they're seeing that they're having difficulty managing, especially our frontline workers, our healthcare providers. They're under a disproportionate amount of stress than the rest of us because their work environment is actually another added stressor where they're exposed to risk day in and day out. They're also seeing people suffering and working with patients who, have varying degrees of impact through illness. So for anyone who is really feeling, overwhelmed or stressed, it's important to make sure that you're reaching out and talking to people. For many hospitals or physician groups or provider groups, they can have EAP programs, so employee assistance programs, which people can reach out to, typically as provided by their employer. But there are also helplines specifically for healthcare providers. And there are 2 national hotlines that have developed through COVID to make sure that healthcare providers have the care that they need when they need it.
Stephanie, how about children? Often children they're in a different situation, and ranging from younger children, they might not completely understand what is going on, to a teenager. Talk a little bit about what a parent or a loved one should be telling their children or expecting normal behavior from their kids.
So depending on the age range, it's important to make sure that whatever information you are providing to your children, that it's age appropriate, and that you really sit down and attempt to have a discussion with them and check for meaning. Oftentimes we use words or terms, or maybe they're paying attention while the television is on and you're not really sure how much they're really understanding. So trying to better understand what their thoughts are about what this current situation is, and then talking to them about their feelings. We have seniors right now that have been looking forward for years to be able to graduate with their class, and they're looking forward to going to college. And this is a significant disruption for them. You've got little kids who aren't able to go to school and see their friends and go to recess, and even so much as celebrate birthday parties with one another. So, the impact on everyone varies, but certainly everyone is impacted in one way or another. Making sure that you follow, some of the same guidelines as far as watching how much media or television people are consuming, especially around the news. Because for some people that can bring additional comfort because it's information, and for others it can provoke quite a bit of anxiety. And then doing the same things that I've spoken about before, maintaining a daily schedule, getting outside, getting exercise, eating healthy, and also trying to go over and beyond to make sure that your kids are able to continue to stay connected with other children, even if it's just by video chat or by phone.
And then on the other end of the age spectrum, many seniors are isolated physically, perhaps in where they're living in situations like that. And now they are even have more of a disconnect from their family. Talk to me about that.
Yeah, the disconnection, I think, is a key issue. Some of our seniors, and even those with increased health risk for COVID, are even more isolated than some of us that are still able to maybe move about in the community to go and fulfill some of our essential daily business, like going to the bank or going to the grocery store. So, it's a time really where neighbors can help neighbors. We want to do so in a way that is sensitive and is safe. So certainly making sure that you can keep your distance. But if you have a neighbor or a loved one or a friend who is, increasingly isolated because of the risk, getting out and trying to stay connected with them, and even, going and checking on a neighbor, those things are very much encouraged. It's about us coming together in a community. And granted, now we're having to come together as a community in ways that maybe we're not used to, because we do have to have that physical distance. It's still important to make sure that neighbors and friends and family members are still able to feel loved and cared for, and that we're checking in on them.
You've touched on this on a few of these questions already, but give me what resources are best available for people.
Sure. So if you go to nvhealthresponse.gov, we have a number of different resources under the Managing and Coping tab. You can also call Crisis Support Services of Nevada 24 hours a day, 7 days a week. And their phone number is 1-800-273-8255. And you can also text CARE to 839-863. So if you feel more comfortable actually texting versus calling, they have the capacity to do that as well. But there are a number of other resources that are available to everyone when you go to that NV Health Response website.
Stephanie Woodard, thank you so much for your valuable information. Be safe. Thank you.
Thank you. Take care.
To learn how Clark County can support you or your business during the COVID pandemic, or for more information on any Clark County department or service, visit clarkcountynv.gov. Thanks for tuning into Clark County Television. I'm Randy Swallow.